Today, I am invited to speak about scope of homeopathy in Canada on this online forum. So to begin with, I would talk about regulation of homeopathic medicines as well as the regulation of homeopathy in Canada. So to begin with, Canada does recognize homeopathy as a natural healing therapy, and it categorizes it under a broad umbrella of naturopathy. So if we are categorized under naturopaths. So just to make some things more clear, in Canada, every occupation is given a code under a classification system called NOC, National Occupation Classification. And NOC is designed to classify occupational information from statistical surveys. So under NOC, homeopaths have been, everybody gets a code. And that's why we know that, okay, fine, this occupation has this code and so on. So under the NOC code 3232, which is practitioners of natural healing, is assigned to homeopathy. And under this code, we are categorized among, there are tons of examples I've just listed. As you can see in your screens, I've listed some of the examples. So alongside with acupuncturists, Ayurvedic practitioners, herbalists, reflexologists, and many more, the homeopaths are categorized under this classification. I'm trying to give you a little bit glimpse because many of my required by everybody, whoever is, wanting to come here and practice here. So it is important to note that Health Canada regulate care products here, but not the practice of educational. But different countries, there are federal and provincial regulations. So basically, medicine by healthcare practitioners, responses fall under the jurisdiction of provincial and territorial government, whereas the homeopathic medicines are regulated in Canada by Health Canada, the federal government department responsible for ensuring the safety, efficacy, and compositional integrity of healthcare products distributed and sold all across the Canada. So Health Canada has formally recognized homeopathic medicines as pharmaceutical product since 1990. By 1998, Health Canada adopted several interpretive guidance documents to elaborate on conditions and means of compliance for homeopathic medicines with the provision of Food and Drug Regulations of the FDA, Food and Drugs Act. Under that act, and these compliance guidance were mainly, GMPs, good manufacturing practice for homeopathic medicines, and labeling standards, and indication for use, such as multi-ingredients, low dilution homeopathic preparations. And they also gave recognition. They are mainly giving recognition of US and European Union pharmacopoeias. NHP regulations, which is Natural Health Products Regulations, came into force in January 2004. And because of that, the homeopathic medicines were categorized under NHPs. The definition of NHP contained in the NHP regulations defines all NHPs, that is natural health products, as drug products as opposed to foods, and they include homeopathic medicines. So it is very important to know that, because we all know, we all are familiar about DIN numbers, right? Drug identification numbers. However, the product licenses granted to homeopathic medicines by Health Canada have a unique identifier prefix, DIN CHIM. So customers and health professionals to more easily identify homeopathic medicines in the Canadian market. So then Natural Health Products Directorate facilitates the appropriate regulation of thousands of homeopathic medicines currently readily available to consumers in Canada. It is really important to note that the labeling standards clearly defined how homeopathic medicines may be labeled and what indications for use are specially permitted. For example, there are very, very strict conditions of labeling of nosodes. Homeopathy takes vaccinations really, really seriously. And there, the Health Canada has requested the NHPs to make certain statements to see an allergy specialist. So homeopathy can definitely kick in those times. But having said that, we are not allowed to make any diagnosis, and we are not allowed to use any words where we are indicating that we are making this diagnosis. We cannot make diagnosis as homeopaths. That's the biggest limitations here. But again, as a classically on me on this forum, we should definitely diagnose and whatnot. But if we take totality of symptoms, I think diagnosis sometimes fall behind, and although I do at my end, but I can't record it anywhere. It should not be in my records that I diagnoses this case. I diagnose this case. So that's a big one more limitation. Is much more advanced in their system and give us a chance. Anyhow, and the other thing that we homeopaths can't do is that we have to avoid conducting a physical examination of the patient. We can't palpate, we can't auscultate apparently, but you have to, on this forum, you have to exercise your own discretion in most of the matters. But as the guideline says, that we cannot conduct a physical examination of the patient. And then regarding the use of a title doctor, I was a little bit hesitant by saying, now in these many years, I have lost that thing to say I am Dr. Harpreet Sawhney, because we should refrain ourselves from saying that here. We can say that we are doctor of homeopathy. We can say homeopathic physicians, but we cannot use a prefix doctor in front of my name as a registered practitioner here in homeopathic world. So my friends, despite few limitations, there is immense scope for people who are passionate about homeopathy here. So I have been practicing homeopathy very, very successfully here. And as I gave you just one example, that when patients here are waiting for their surgeries and to see the allergy specialist, we pitch in and give them much needed cure or much needed relief from, I must say. So before I wrap up my brief sessions, I would like to address a very important issue on this platform, and that is COVID-19. Today, the world is undergoing a crisis never seen before. The need of the hour is to come together as we have come today on this online forum. I really urge all the homeopaths across the globe to come together in this dire situation. You know, as Hippocrates said, wherever the art of medicine is love, there is also a love of humanity. This is the time we can actually serve the suffering humanity. When I was in NIH and I had some experiences where we used to sit in the OPD, and one lady came to me and she said that, because we were in the routine practice of asking, we used to say, ask so many questions that milk and milk product, does it bother you and whatnot. I vividly have her image in my mind. I can't forget that. And she asked, "Kono din khai nahi," that I have not tasted milk. And I was like, we take these many things for granted. I thought that that was the epitome of suffering. But now when I am seeing this, I thought that I'm in Canada, the North America, the standards are so high, everything. But I am seeing people suffering, and my colleagues, some of my very nice friends, which I made in allopathic world now, they are working as doctors, as nurses. They're really crying out in misery. They're saying that, this is the time. So this is the time when we can actually serve the suffering humanity. This is the time for the world to know that when the whole world was suffering from Spanish flu way back in 1918, homeopathy was bringing about much needed respite with subtle medicines. we what a day to celebrate homeopathy. This is kind of a resurrection right now, Hom- all the homeopaths, this is the time to act. And we keep on thinking that, what, um maybe our associations are not helping, and we can do a tad bit everywhere. We can do a tad bit everywhere. Wherever you are, you urge your associations to step up. If not now, then when? Step up for helping the ones in need. Maybe ask them to give access to patients who are in quarantine or maybe in self-isolation. Put the word out that this is the time when homeopathic medicines should be given in initial phases to nip the evil in the bud. We are waiting, we are saying, take arsenic album, take this, take that, and then we fight on the classical forums, and that this should be done, this should be done. Just do it. Take the patient, ask them, maybe educate them at your end, make some YouTube videos, tell them that, what, these are the symptoms that you can take homeopathic medicines. If you can take homeopathic medicines on your own, any homeopath for that matter, if you are suffering, if you at the slight inclination of cough, of fever, of sneezing, because we are dealing with a thing where we don't even know the exact symptoms. And what I would also like to mention here, in today's world we are dealing with, as mentioned in our books, hideous monsters of complicated diseases. People who came to us, who come to us, are taking modern medicines, are leading a very fast and stressful life. Many are addicted to coffee, alcohol, tobacco, sometimes narcotics. I'm seeing in my clinic people are taking weed and meth and whatnot. So, we have to take a holistic approach. Here, I'm sure that, all the homeopaths will say we are holistic, and, but the need of the hour is, I'm talking about the approach which really goes beyond holistic medicine as well. That's why I like to call it deeply holistic. In Western medicine, Western world, people are readily recognizing this fact and finding solace with self-healing methods. I'm fortunate enough to have gained experience in those fields, and I urge all my fellow homeopaths to explore those less traversed methods as well, about which Henneman have also talked about, or rather, I should say, gave hints about in the later aphorisms of Organon. We have to strive, and we should, to become experts in homeopathic medicines and holistic approach, no doubt in that. But we also have to brace ourselves with the latest techniques and procedures and knowledge which can actually make us healers, by restoring mind, body and spirit balance, and thus leading to permanent restoration of the health. Though, maybe it's knowing of some techniques, some massage, some exercises, whatnot, supplements. We need to know so many things. We have to not, we have to start looking beyond homeopathic medicines. It has to go definitely in the holistic sense. So that is why deeply holistic. On that note, I would conclude my talk. Hope I was able to give you a glimpse of homeopathy in Canada. I thank everyone for being a patient audience, and stay safe, everyone.